Hello, I'm Dr. Mustafa. I'm a new foot and ankle specialist in Port Charlotte, a podiatrist, and I'm joined here by Dr. Mason, a new physical therapist in Port Charlotte. I've asked Dr. Mason to come and talk with us today because I treat a lot of Achilles tendon, just a lot of tendon pathology, and I wanted him to talk with us about the important role of physical therapy when treating this condition. So, Dr. Mason, welcome, and I'd like you to tell us a little bit about you and your background.
I graduated 15 years ago in 2005 and 6 with a master's and doctorate at the University of Utah. I did my doctoral work on Achilles tendon rehab, which actually applies to all long tendon and a good portion of the short tendons in the body. Since then, I've had great success. I was kind of the tendon guy in my area up in Idaho, and now that I'm in Florida, I'm trying to become, the guy that people refer to for tendon pathology.
Very good. So let's start with talking a little bit about what physical therapy's role is when treating tendon pathology, because I feel that a lot of the patients don't really understand why I might refer them to you once we've made that diagnosis.
So physical therapy is really any problem with a muscle, a tendon, or a ligament, sometimes a bone, depending. So the role of physical therapy in tendon pathology is that we help remodel the tendon back to normal use. We're trying to get the tendon so that it functions as it should from the muscle to the bone, and delivering all of the force that it should be, so that the movements are concise and appropriate. In addition to that, normally if there is a problem with a tendon, we also have a problem with other muscles and joints in the body, and so we need to tackle those as well. And so the idea is physical therapy is there to create an environment so that your tendon and your muscle are responding appropriately with the joints in tow.
Very good. And of course, there's a reason why this issue occurred. So we will work together to figure that out, and you may need orthotics, some other things that I might assist you with in combination with working with physical therapy. So I also wanted to ask you, what about timing of physical therapy? How important is it to get started right away? Should they wait a little bit? Should they do things at home before coming to physical therapy?
So the golden window for physical therapy for a tendon pathology, if it's a tendonitis, is 3 to 10 weeks after the injury, which is normally about the time that you get into physical therapy anyway. The idea is that if we can get you in during that time, then you've hit the remodel stage of the tendon, and so it's no longer quite as painful, and there's a matrix that gets laid down, and so that's all there, and so we can use it. What to do before is keep moving in general. A lot of people think, oh, my tendon is hurting, or my muscle's hurting, or whatever this is hurting. The idea is keep moving, because once you start losing muscle mass, then it becomes harder and harder to treat. In addition to your joints getting stiffer, your tendon gets stiffer, and so it gets harder to treat, and your cardiovascular condition goes down. And so keep moving, but don't go overboard.
Very good. And then specifically, let's take some time to talk about the exact treatment methods that you recommend for tendon pathology.
Okay, so the best treatment methods for, say, a tendonitis, not a full rupture, are some sort of loading program where we increase the load on the tendon. Sometimes we have to increase the load on the muscle in excess of what the muscle can handle, which is called eccentric exercise. That is actually what the research supports the best for rehab. And it's not the most comfortable, but after the first visit or during the first visit, most people experience about a 50% decrease in pain if they could just deal with that little bit of pain. In addition to that, there are manual techniques where we essentially do a scraping along the tendon, and potentially, depending on the tendon pathology, in opposition or perpendicular to the fibers, depending. And so those are the treatment methods that work the best. In addition to, if we're looking at the foot and ankle or the knee, we need to do a lot of balance. Lots of balance to make sure that all the tendons are firing, all the muscles are firing correctly, that the tendons that sense the movement are responding accurately and fast, so that you're less likely to sprain your ankle or anything like that. And that's the best treatment methods, in addition to just kind of getting you moving and getting you active again.
Okay, very good. Well, I think maybe we can show the patients what that looks like. So we'll have our model come join us, and we'll do a quick demonstration.
All right, so here we're going to look specifically at the Achilles tendon. So the Achilles tendon goes from your calf muscle, which actually crosses the knee, down to your heel. And so depending on where the problem is in the Achilles, we might be, say, scraping. So this is a scraping tool. Here's another scraping tool. There's so many different ones. You can even use a spoon. But the idea is that you go from the distal point or the heel up, and you kind of find the spot that's catching. And so you kind of rub and work that spot to kind of loosen up the material around the tendon. So the tendon has a sheath around it that we try and loosen up from the tendon, because it gets adhered to the tendon when the blood vessels grow in to provide more of your stem cells to treat yourself. And so we need to peel those back, and the way we do that is through some sort of scraping technique along the tendon. Frequently, if there's a tendon problem here, the calf is also super sore. And this is where tools really come in handy, because normally it's a deep calf that we're looking at. And so we have to kind of get deep and in and find that tender spot and work it. And we don't want to break off our thumbs, and we want to have a good long life expectancy as a physical therapist. And so we'll find that soleus muscle and kind of scrape along it, and we can scrape here. Is that tender?
I'm good.
You have some pretty good bumps through here.
Yeah, I've had trauma to that leg.
Okay, so, and now with that much motion already, it has smoothed out. So we started out with quite a few bumps, and now it's a lot smoother. Of course, we can peel up the pant leg, get some sort of lotion, and then do it as well. Without a lotion, this becomes a little too aggressive and actually gets more of the skin.
What's expected after their first treatment? Could you go over that again? Like, what is normal? Low soreness is normal. How long does that last?
So when we're talking about this treatment,
Yeah.
you should have a significant relief in the calf. In fact, it should feel pretty good here when we're done right away.
Okay.
Here, you might experience tenderness for about 2 days, because we're creating another inflammatory response.
Yes. So don't be concerned. I try to tell patients you're going to have a little soreness, but please continue, because the benefits, I promise you, will outweigh that initial discomfort you had.
Okay?
Yeah.
So that's one treatment method. And again, we have multiple different ways that we can use tools or hands to kind of get in there and work that tendon and the calf. So here we're talking specifically about the Achilles tendon. If we were talking about, say, some of the balancing muscles, like say if you also sprained your ankle in addition, then we might be looking at some tendons along here and kind of scraping through those, as well as specific point. We can do trigger point, we can do dry needling, or essentially an acupuncture type treatment. And all of that is to create a reduction in the tension here, so that the tendon can heal a little bit better without that constant tension on it.
Very good. And then, Jeremy, if you want, you can continue, or if you'd like to get up and tell us how it feels.
Feels fine. I feel good.
Not too soreness?
No, not at all.
Very good.
So the other treatment, keep your shoe off. Let's actually move things around, and let's get you on a machine over here to try something else.
Okay.
So when we look at, say, here we're looking again at the Achilles tendon. There's so many other tendons that we can be looking at. What I want you to do generally is I want you to be able to do a straight calf press. And so take that foot off and put it on right there, okay? And now keeping your knee straight, press up, there, and all the way down. Oh, without bending your knee. Okay, so all the way up and all the way down. You're lacking a little bit of mobility there. So if you can do that, then this is too light for a specific high-load eccentric exercise. Granted, depending on your age, I'm going to be looking at different ways of doing this. But what we want to do is we want to make it so that the muscle has a hard time doing the exercise, and so it puts all that stress on the tendon, and it's enough stress to cause an aligning of fibers in the tendon. And so go ahead and put your other foot up here on kind of on the same spot. And so now locking both knees, okay, press all the way up, take that foot off, and come all the way down with just this leg, okay? Now go back, put this foot back on, all the way up, take that foot off, and all the way down. So this is an eccentric based exercise. The idea here is that we're helping out with the other leg so that this muscle doesn't fatigue as much, so it can have greater, longer lasting force. After about a set of 10 of these, depending on your age, depending on the problem that you have, then you'll get a rest break, and we might do 2 to 4 sets of these to try and get that muscle to not fatigue still, and the tendon fibers to align. Your tendon responds much like your bones do with lines of force, and so we need it to strengthen in this line of force that you're using. So this is a simple exercise. You can take your feet up, or you can put both feet up here. So now another simple exercise. Let me slide this in. Okay, put both feet on here, one on each side. Okay, so now we have some balance component to it as well. And so bend your knees all the way down, okay, and press up. So here we get the calf to be responding with the knee and the hip, as you normally would. And this is an unloaded environment versus doing a squat that then is very loaded. So this would be, say, a simple starting point for rehabbing your Achilles tendon. The problem, okay, go ahead and take your feet off of there. The problem that most people experience with eccentric exercises is something called delayed onset muscle soreness. So if I were to have done a full treatment with you here, you could expect your calf is going to be sore, not today, not tomorrow, but the next day, and possibly the day after, kind of like you've gotten a great workout. And that's what I would have to remind you of. This isn't damaging things, it's actually making the muscle stronger in addition to the tendon. Okay, so let's move to a different position now. Here we have another treatment. So this is then an advancement over, the one that we just saw. So here, go ahead and grab a hold. So at home, we would have you, have something very stable that you can hold on to so that you're not at risk for falling or anything like that. And just like with the other platform, you're going to step all the way back there, and you're going to go up with 2 feet and down with just the bad one. There and down. Okay? Up with 2 feet. So you got to put your other foot on while you're still down, then take that foot off and down with just the one. Okay? And so this is then the treatment. Again, we do a set of 10-ish, and you do 3 or 4, depending on how painful this is. If this isn't painful at all, again, we're looking for some pain here because we're trying to make this a hostile environment for blood vessels that have grown into the tendon and the nerves that come with them that we no longer need. And so We're trying to make this a hostile environment and really force that tendon to rehab. So if we do too much of this, we actually degrade the quality of the tendon. And so we're looking at a very specific amount, and that's part of where physical therapy comes in, so that we can identify just how much work we should do. You know, if anything is aggravating it, then we're doing too much, but at the same time, we want to push it hard enough that it does hurt. So that's another simple treatment for it. There are all sorts of things that you can use at home that can help, like say, so again, here we're looking specifically at the calf. This works for just about any tendon. A lot of times we will get this constant tendon tension that we need to reduce at some time so that it has a good appropriate amount of time to heal. And so at home, there are lots of different things that we can do treatment-wise. I mean, you can get a $300 massager if you want, or you can get like a $10 or $20 tiger tail or something to that effect, where you can work your own muscle out. So here, grab a hold with both hands, but you're going for your calf, so swing it behind your calf here. There, okay? And so in that position, scoot back a little bit so you can rest your heel on the table. Bend your knee right there underneath the calf, and there you can apply a lot of pressure up and through the calf. And so you identify that spot, or those spots that we found before that have high tension amounts. And so you might be, say, going here and rubbing there, or going on the outside, or whatever that spot tends to be.
And looking for that trigger, that area that's a little bit sore.
Yeah, that we have that constant tension in, and you'll notice it because it has that pain. So this is a simple, cheap tool. Of course, you can use a rolling pin. Just make sure you clean off the flour. And there are a few other things that you're going to expect at home to treat yourself. There should be some calf stretches involved that are simple to teach, some ankle motion just to kind of maintain everything that you have so that we don't lose form, function, and mobility.
Very good. And so I'm glad that you mentioned that, because my next question is, what happens once the patient gets discharged from physical therapy? Are they going to have to continue these exercises? For how long? What is it that they should expect once they're discharged?
So normally there should be a few exercises that you take home with you. And throughout therapy, there should be some exercises, hopefully not so many that you're doing it for hours at a time, but say 10 or 15 minutes, 2 or 3 times a day over the course of your therapy. And then at the end of therapy, you should have a home exercise program that is going to be incredibly efficient to finish out whatever it is that you're lacking, whether it be strength or mobility. Because let's be honest, you don't need a physical therapist to count your repetitions most of the time.
Yeah.
But you do need the physical therapist to identify how much force, when, and how.
Okay.
And so at home, we'll send you home with some very specific exercises to do, and normally those will last, depending on your injury and where you're at in your rehab. It might last 2 weeks, or it might last a few months, or you might be doing balance exercises for the rest of your life based on your age.
Okay, very good. And then one last thing is, when a patient does get referred by a physician, what is the process of getting into physical therapy? How does that work?
So a lot of that's going to depend on insurance, unfortunately. Generally, most states in the United States have a direct access, so you can get in, say, the next day with a physician's referral and start talking with, and setting up an appointment. It depends on the therapy clinic. Some, certain clinics at certain times of the year will have a backlog of 2 or 3 weeks of appointments that they have to see before you. But the idea is that you should be able to find a therapist pretty quickly. You should be able to get in within a week, and you'll have to present your driver's license. That's kind of required by the government to be seen. We'll need your insurance card, fill out paperwork, and it's kind of you get in and you get seen. Physical therapy differs from a lot of other medical professions in that, like say, I might be beating on you for an hour at a time. Versus when you go to your doctor, they might only have 5 to 15 minutes with you, depending on what's going on. And so we really get to go through that time with you and make sure that everything is appropriate in your intensity. And so generally, if you have a prescription from your doctor, it's kind of like going to a pharmacy. You might have a little bit of wait, and then you start.
Okay, very good. Well, again, I'd like to thank you for taking this time and educating us about what to do when we have tendon issues. Is there anything else that you'd like to add?
I think that we tackled it all. If you do decide to do some of your own therapy at home before coming in to see a physical therapist for a tendon issue, I do not recommend doing high-load eccentrics, so those up with 2, down with 1 exercises, because those you do need closely monitored.
Very good. Again, we'd like to thank you, and please contact us if you have any questions or like to learn more.
Thank you.